Lyme disease, a bacterial infection transmitted through the bite of infected ixodes ticks or deer ticks, was first identified in 1975 in Lyme, Connecticut. This identification followed an outbreak where children and adults exhibited uncommon arthritic symptoms, leading researchers to the discovery of the Borrelia burgdorferi bacterium, the disease's cause. The occurrence of Lyme disease is deeply connected to environmental changes and human behaviors. The spread of the disease correlates with the movement of suburban development into wooded areas, increasing the interaction between humans and the habitats of tick-carrying animals such as deer and mice. Moreover, historical land use changes, particularly the reforestation in the northeastern United States, resulted in a booming deer population, which significantly contributes to the proliferation of adult deer ticks. The reasons behind the frequent infections of Lyme disease are multifaceted. First, there's a noticeable geographic expansion of the disease as humans continue to encroach into forested areas, which are the natural habitats of ticks. This expansion is further aided by climate change, as warmer temperatures extend the active periods of ticks and make previously inhospitable regions more favorable to their survival. Additionally, the rise in Lyme disease cases can also be attributed to improved awareness and diagnostic techniques. Over the years, there has been enhanced surveillance and recognition of the disease in the medical community, which has led to an increase in diagnosed cases. People are also more aware of the disease, leading to higher reporting and detection rates. Finally, certain environmental and lifestyle factors contribute to the spread of Lyme disease. Activities that increase human exposure to tick-infested areas, such as hiking, camping, and gardening, raise the risk of tick bites. The preservation and expansion of natural habitats that support ticks and their hosts also play a crucial role in the disease's prevalence. In conclusion, the prevalence of Lyme disease is driven by a complex interaction of ecological, environmental, and human factors, highlighting its continued spread and the rising number of infections each year. Since its identification in 1975, Lyme disease has become the most prevalent vector-borne illness in the United States and Europe, with significant impacts observed across various regions, including some parts of Asia and Australia. Each year, approximately 300,000 new cases are diagnosed in the United States alone, according to the Centers for Disease Control and Prevention, CDC, with tens of thousands more reported throughout Europe. This widespread occurrence highlights the substantial geographic reach and public health challenge posed by Lyme disease. The impact of Lyme disease extends beyond its immediate symptoms, which typically include fever, headache, fatigue, and a distinctive skin rash known as erythema migrans. If not treated promptly and appropriately, the infection can disseminate to joints, the heart, and the nervous system. This progression can lead to more severe health issues such as arthritis, cardiac problems, and neurological disorders. Moreover, some individuals develop chronic Lyme disease, or post-treatment Lyme disease syndrome, PTLDS, where symptoms like fatigue, pain, or joint and muscle aches persist long after the initial treatment, severely affecting their quality of life. Prevention of Lyme disease is crucial and centers on reducing the risk of tick bites. Effective measures include wearing protective clothing that covers the skin, such as long sleeves and pants, and using insect repellents containing DEET or permethrin. Environmental management strategies also play a critical role. These include clearing tall grasses and brush to reduce tick habitat near homes and creating tick-free zones with wood chips or gravel to deter tick migration into recreational areas. Additionally, conducting thorough tick checks on the body and clothing after being in wooded or grassy areas is essential for early detection and removal of ticks, which is vital since the risk of infection increases the longer a tick remains attached. Public health education is another pivotal component of prevention, raising community awareness about the risks of Lyme disease, emphasizing the importance of proactive tick prevention measures, and educating the public on the proper steps to take if bitten by a tick. Together, these strategies aim to mitigate the risk of Lyme disease, addressing both individual and community health needs in the face of this expanding threat. Since its discovery in 1975, Lyme disease has emerged as the most prevalent tick-borne illness in the Northern Hemisphere, particularly affecting temperate forested regions of North America and Europe. The disease, caused by the bacterium Borrelia burgdorferi, is transmitted through bites from infected black-legged or deer ticks. Today, Lyme disease poses a significant public health challenge, with the Centers for Disease Control and Prevention, CDC, estimating around 300,000 diagnoses annually in the United States alone. This figure likely underrepresents the actual number of cases due to frequent underreporting. Lyme disease symptoms can vary widely but typically start with a distinctive bull's eye rash around the tick bite, accompanied by fever, headache, and fatigue. Without appropriate treatment, the infection can spread to the joints, heart, and nervous system, potentially leading to severe and long-lasting health issues. Some individuals may develop chronic Lyme disease or post-treatment Lyme disease syndrome, PTLDS, experiencing prolonged symptoms like fatigue, pain, and muscle aches even after undergoing treatment. Preventing Lyme disease is crucial and involves several strategies aimed at minimizing tick bites. Wearing protective clothing such as long sleeves, long pants, and closed-toed shoes is essential, especially when venturing into areas known to be tick-infested. Applying tick repellents containing substances like DEET, picaridin, or IR 3535 to both skin and clothing can provide several hours of protection. Additionally, treating clothing and gear with permethrin can deter ticks from coming into contact with the skin. Avoiding habitats where ticks are prevalent, such as high grass and leaf litter, and sticking to the center of trails during outdoor activities can reduce exposure. Conducting regular tick checks after spending time outdoors is vital for early detection and removal of ticks. At home, maintaining a tidy landscape by mowing lawns frequently and removing tall grass and brush reduces tick-friendly environments. Education and public awareness about the risks and symptoms of Lyme disease are critical for its prevention and control. By increasing community knowledge through public health campaigns, individuals are better equipped to take proactive measures against Lyme disease, facilitating earlier diagnosis and treatment. Collectively, personal protection strategies, careful environmental management, and enhanced public awareness form a comprehensive approach to managing and reducing the impact of Lyme disease.